So tip 1 is setting up the actual motor. So this can be for both dentists or nurses if they're setting up for yourself as well. And it's just a quick run through on how to set up efficiently, easy, and just make sure you have the right settings on. So step 1 is you've got your base, your motor, you have your handle for the irrigation, for the saline, and your handpiece. Always run the tubing through. A quick tip is when you're running the tubing, always clip it in. It just makes it easier, means there's less clutter with the actual tubing on the handpieces. When you're plugging in your handpiece, always make sure it's red to red. So instead of jiggling it like this and damaging the wire, always go red to red and clip straight in. So when setting up the motor, there's a number of different settings you can have on the screen depending on what you're utilizing the actual motor for. So you have an implantology setting and oral surgery. You can also make this bespoke, as I have done with a user setting. So if we click on that for demonstration purposes, this has a bespoke setting for the implant system I'm using. Bear in mind you can have a number of variant implant systems, and you can set it accordingly depending on that system. But for the purpose of this, I'm using a system I commonly use, which we'll use later, but also I've set it up accordingly. Now, to give you a run through, you can either shift it on the foot pedal or on here, but I'll show you on the screen first just so you can see. You have a 2000 RPM setting, that's the first one, and that's for the precision and pilot drill. As you go along, you can either click on here where you go to your 800, and that's for your draw sequences as you're preparing the site for the implant. In addition to that, you can also switch it with the foot pedal automatically. So if we go onto the implant setting, automatic goes through, and that's the middle button as shown. You can also have water on and water off again through your foot pedal, pressing the green one, but for the purposes of implant placement, you always have water off. And then if you are using the implant setting, if you want to reverse or come out, you press the yellow one and that will reverse for you. Again, you can do this on the screen as well. There you go. And then you have an ISQ as well, and the purpose for the ISQ is to measure the torque. However, I'll demonstrate that later on a model so you can see the difference. The next aspect is making sure your pedal's paired up. I use a wireless pedal, so it's paired up already. Now when you're using the motor, clip it off here. You have two options when holding it. Make sure you always press it first on the side. You'll see the water run through and come through the other side. The advantage you have on here is you can see the variation of your speed and then the water coming through. One aspect I would say, instead of putting it on the handpiece, always just leave it on the worktop flat. I find that works much better. Any drill pieces you have, I'd always take out and leave on your worktop and leave it there. But then at the end, place it back on the top, and then it's easier to sterilize down and clean. So this represents the surgical cassette that we use. As you can see, everything is enclosed. This is all autoclavable, so you can put all the instruments in here, straight in the autoclave, and you're good to go. Now the advantage is a lock system, so you can easily open it up, straight over and through. One of the advantages you have with this system is you have all your instruments in one place. Very useful if you're doing different types of surgeries, if you're doing multiple surgeries. You have all your forceps and tweezers here as well, so you can use them at any point. One of the items I definitely love is the suture holders here. They click in, click out, which is fantastic. Very, very easy to manipulate, very easy to use, especially with soft tissue. So this is a really useful tool. Another one that I really like is this one here. I love this elevator. I use this a lot. So this is a common preference of mine. The advantage is if you wanted any more, you can always top up or buy another one there. You have your scalpel holders here as well. But everything essentially is in one place. So this is at the top. So very, very easy in terms of you using them, in terms of cleaning and placing back. And yeah, very straightforward to use. So it's a kit I would recommend. Okay, so on the previous tip we showed you how we were doing setting up the motor, and then also your surgical cassette with all the instruments you'd be using. Once you've established that and arranged that, the next step is actually your actual case. So that would normally be planned on your CBCT scan. You would understand the implant you would use and the diameter and length you intend to use. So in the demonstration today, what we're showing is a tough implant with the drill sequence clearly present and the actual RPM that you would use on your motor, the drilling speed. Now the reason I'm showing this is something, another tip is I would advise always print the page off the implant you're using with the sequence, have it laminated and put it on the wall or next to where you're working, so you always follow the same sequence. The reason for that is because there's different implants available on the market, different brands, different systems, and they all use different surgical kits and different have different actual sequences. So always, it's just a safer way to work is have the implant you're using, the sequence and the correct surgical kit all arranged beforehand. The next step is making sure your motor is set up accordingly. So in this instance, we know the drilling speed is between 1200 to 1500 and then goes to 400 to 700 as we go through the drill sequence. So what I do is I typically would set it as the maximum, and then you can control the variable with your foot pedal. Okay, so we now understand that the drill sequence, the surgical motor that we're using. One thing to just have in your mind beforehand, this gives you an overview of all the components. Today we're demonstrating using a tough implant, which is up here at the top, and then we're working our way through, so you understand if you need a cover screw, healing cap, then also understand your prosthetic elements. There's a variation of components available, and it's what you choose and what you need. The advantage you have with this is because there is loads of different options, it can aid you with the prosthetic side. And the reason we mention that is because we're doing prosthetically driven implant planning. So planning where the crown is first and then the implant. So we understand the implant we're using, and we can see the different angle, the different multi-units, different angled abutments as well available. So you can see them all present, and it's determining what you will use and how you plan your case. Bear in mind you would have planned this on your CT scan beforehand, and then you should just have a knowledge of all the components available when you're placing. Next step, we have our mandible, have a jaw place to show the demonstration for you. Now whenever you do this, especially in the mouth, have a few things just ready in advance. So the actual system we're using today is Norris Medical. Always keep it present, understand your system, and that's what we have laminated and on the wall so we understand it. Second component is the Torque Pro. It's a really nifty device which I'll show you once we've placed the actual implant, and that allows you to torque the actual implant down, especially in those very, very tricky areas. Third aspect is your motor, making sure you have everything set up and your handpiece ready. And I'd always suggest knowing the implant you will place. So we've got two implants here, 3.75 by 16 and a 4.2 by 18. Both tough implants, so we know the sequence is with this drill kit. In addition to that, I'm just going to show you for demonstration really cool bone material I use called OsteoSynth. It's completely synthetic, very useful in areas where if you've got patients with religious concerns or even patients that don't want any animal product, this is something I'd highly recommend and definitely look out for. But it's something I use, especially because in the area I work in, religious concerns are raised and they would prefer any grafting without animal product. Okay, so we have our implant present. One thing I'll say, this is one with a holder. You can get without a holder as well. Cover screw on the top, so use your driver. Gently remove the cover screw, like so. And what you'll find, it'll gently lean off like this. Always keep it on the side there. Then you want to make sure you have your implant drivers. So, something like so. Straight in to make sure you're good. And what I typically tend to do is leave it on the side, pop it into your handpiece, so make sure it clicks in. Always change your setting, so you can do it with the foot pedal as well. So There you go. Make sure I always put it to 32 newtons. I find that's a good amount, and I don't fully place the implant in and then use the torque wrench or Torque Pro after to place. And when you're doing it, always hold it upright. What I typically tend to do is you always want to wriggle it out slightly, and you'll find it will naturally come through like so. So you have it locked in like so. It's locked in quite nicely, and when you're placing it, always hold it through. You'll find it will lock in, so you can tilt it all the way around, get it comfortable. When I'm carrying it across, I typically go like this all the way across. Remember, your gloves are sterile, so you're okay. Now whenever you're placing your implant, always lean to your side, have your placement correct. Now when you're placing, hold the implant down, don't just spin, don't put, the one thing you should do is always put apical pressure when you're placing. So for instance, when we're placing, always lean it in, check buccolingual angulation, always apical pressure all the way down, and you'll feel it drop in nicely. Remember, you're placing it under compression, all the way down, you'll see it nice again. What you should hear is you should feel it torque out like that. That's fantastic. What I typically tend to do at that point is then use my torque wrench or Torque Pro, and we just slightly twist it in. Okay, so next aspect, so now we've got our implant down, we know it's under compression, so what can we use in order to actually torque it more down? So option one is your torque wrench, typical torque wrench, in, out. So we know we're going in. Beauty about this is you can actually set your setting, so you have it, the settings down here, and you can go up and down depending on what torque you want to go down to or up to. So adjust it accordingly. You then put your driver in, torque through. Now when you torque through, you'll hear it click. Another aspect I would use, or another instrument that's really useful, is something called a torque wrench, or Torque Pro rather. And the reason I'd use this is you put your driver in, really nifty instrument, especially in those back areas. Now what you do is you set your torque, so say you set it to 30, 35, let's go 30, that's a good enough one. Always click it in like so, hold it, have your torque setting correct on 30, and then you just turn to screw in. So that's a nifty little tool. Option number two, or other option, is using your normal driver, click it into your torque wrench. What you'll find is you want to go in, so you want to make sure you're in, lock it in. I always typically at this point tend to put apical pressure on the top, and then whenever I place, apical pressure, always apical pressure. So you really want to press down. You can see the amount of pressure I'm placing, so you can see it go sinking all the way nicely down. And what I tend to do, the reason I did it in this specific position is to show you, because you have slight buccal bone resorption here and it's going down, what I typically tend to do, even if you've got higher lingual, I typically sink it slightly, just like so. So as you can see, it's nicely sunk, just there. You can see bone level. I would still go one turn more actually, just so you can see, and the reason for this is you just want a good final aesthetic result. So as you can see, still a bit visible. Lock it back in, so your connection is like so. Lock that back in. Once it's locked in, just want to go tiny turn, just till it's in. Apical pressure, beautiful. There you go. As you can see, nicely placed, nicely through, all the way in. So implants placed, cover screws in. You can always have a healing abutment for the purposes of the next bit. I've taken that off. Now when we have this here, this is your impression stage. There's three choices really. Open space special tray, closed special tray if you want to, and a scan body. I typically use open or a scan body. Now when you're using it, the good thing with this system is the pressure coping is available. It can fit on all of the platforms. It's an internal hex, so what you'll find is it will lock in like so. Always make sure you're check it with your adjacent teeth. Turn down. Now one error I always see is whenever it's not fully seated. So what I would typically tend to do is use your driver and tighten it down so that you know it's always seated. If you're unsure it's seated, just take a PA and ensure that your impression coping is seated. So you can see it's fully down. Now one aspect when taking the impression, like we did on the other tip, is make sure you keep this area clean, keep it accessed, and then you can always unscrew it down. So that's not a problem at all. So you've got open space special tray coping, always make sure it's seated. Exactly the same principle when you're using a scan body. And with a scan body, what you want to typically do, again, screw it all the way down and ensure that it's fully seated. So like so, have your scan body present. Again, same connection. So locks in, but that isn't, you can't leave it like that. Make sure you've driven it all the way down. Make sure it's seated all the way. So when you're scanning, you have a good scan. So when you're scanning, remember it's always cut out, and then you scan with the scan body in. So initially scan without your area of the implant, cut it out, then scan within over. So that's two aspects for you. Always remove it after. So you can see how it has to be fully seated down. Common error with most restorative aspects is if this isn't seated, impression coping isn't seated, and that's where you typically get your errors. So always ensure it is fully seated. So at the impression phase, or the restorative aspect, what we do is remove our cover screw or healing abutment, and then you can essentially see where your implant is placed. You see where your implant is placed, you then place open space impression coping or a scan body. If you're doing digital, scan the entire arch like so without the cover screw. Then on the software you cut out a round circle around so on the actual software, and then you place a scan body in, seat it down, and then scan this area with the scan body. That way you get the best result. And the reason for that is to really get a good soft tissue profile and allows for a better aesthetic result. So this represents the one aspect of impression taking. Whenever we're taking impressions for implant crowns, ideally screw retained, ideally, but cement as well. You can take impressions, but ideally for screw retained. There's two options. There's closed tray impression, open space tray impression, and digital, which is with your scan body. In this instance, what I'm going to highlight is your open spaced special tray method, mainly because it's an area we've come across, we use quite regularly, and we get questions on it. So I just want to show you a quick tip and technique for it, and it should do the trick for you. So to give you an idea, I'll do it on a model. So we have a model here, with an implant placed here in your upper molar region, and this is the special tray that's made. As you can see, it slots on quite nicely with a window over the area of the implant, and the reason is because that's what we're taking an impression of. So if we highlight to you what we do, so this is as if it's in the patient, you have your screwdriver here, take out your cover screw or healing abutment. I would always irrigate and wash the implant out before I do anything. Usually with chlorhexidine is perfectly fine. You then have your impression coping here. So we'll open it up. I'll show you. What I'd suggest always is drop it on the table, so it drops on. So never ever hold it in your hand, drop it on the table. Now you've got two aspects. You've got the coping, which is here. As you can see, it slots in. Now I've deliberately put it in this orientation. However, ideally what you'd want, you can rotate it around. So you can rotate it in many different angles, but you should be seated. So you've got to make sure whichever way you put it in, it's seated down. So it's essentially like a fin. I'm going to show you a different orientation, just so you can see you can orientate it that way as well. So make sure it's always seated all the way down. Once you have that in, this is your screw, straight in, you'll feel it, slowly tighten. You can hand tighten it, but that will tighten in, as you can see. Tightens in, should be seated. Now you want to check before you do anything, check your special tray, check it locates right on. There you go. Beautiful, no interaction, no stoppage. So most of the times what you get is either it's not seated or your actual coping is blocking the tray. In this case, you're good on both sides. So what we do, we then take our impression material, we load the entire tray including the window, and then we place it on there and remove it. So we'll do that for you now. So I'm using a putty in this instance. We have a base and a catalyst. What we just gently mix it together so we get a good consistency. And what we're going to do, we're going to load the actual special tray all the way around, and then I'll show you what we do with the extra bits. But you always want to make sure you've covered the window. Very, very, very crucial to cover that window. Other materials you can use Improgum. Quick tip here, what I would always recommend, if you're worried about adjacent teeth, then you can put a bit of lubricant or Vaseline on the adjacent teeth. That just helps with removal. So you've got a nice consistency. Always roll it into a sausage kind of shape. So it's like this, probably a bit more uniform. And then you place all the way around. Right, any excess you remove. Place it nicely around. Now what I typically tend to do while my nurse is doing this with the excess, take a bit off like this, and I tend to put it all the way around. I tend to pack it down, remove the top, but pack it all the way down. And the reason I do that is then place your tray on, you'll notice excess will come through. At the same time, finger, remove the top bit, like so. You should find it seated all the way down, and I typically tend to clean that. Now we leave that to set and just wait. We clear any aspects around. Like this, so you want access off this screw. You can see it's fully seated at the front, like so. Yeah. So one thing I would do when you're setting up, just get a probe and the area of the access hole, just clear out. You can do it while it's soft, but when it's clear, when it's set, it's easy to. Main thing is you've got good clearance here, so that's key. So just clean it out from any excess. So now we've cleared it, and it's the actual screw access hole is clear. Get your screwdriver, place it within. It should lock in like so, and then what you're doing, slowly turning. You'll find as you turn, the actual screw for the impression coping will lift up. Slowly, so you can see it's lifting as you go, and you can see it's lifting up. So you can lift it up like so. It's for demonstration purposes, and then you slowly lift. Okay, so your model taken, your impression taken out. As you can see, a really good seal around here, sturdy, good impression coping, and as you go from the front you can see where it is. So a very good case, very good mold, good uniform all the way around. More importantly than palladial is your buckle. So you got good flange, good area all the way around. Even got the back, which you don't really need, all the way to the 8, so I would always probably cut that off, just makes it easier. And when you're doing the impression, remember when you keep it, always keep it down like this. It's just better when it's in transit. That's your impression, that's your open spaced impression tray. So just to recap a few quick trips, make sure you lubricate adjacent teeth, impression coping seated all the way down, tightened, impression on top. Make sure when you're doing it you clear this aspect so you can unscrew, and once you've unscrewed, lift up gently, back and then front, and voila.
So let's show you how to scan for a multiple implant case. So here's the antagonist. I've scanned the lower and I've scanned the upper after you've removed the healing caps. Okay, so the region of interest is the emergence profile in this scan. So what you want to do is scan around the other areas of the teeth and then whip the healing caps off and then scan the emergence profile. Now, once you've captured the emergence profile, you can pop the healing caps back on and then take the occlusion. So I've taken the bite in several different positions to capture that centric occlusion into cuspal position, and then you then open up the implant workflow here, and this is how you add to your existing scans. Okay, so the first thing you do is, let's go back, there we go. So first thing you want to do is cut around the emergence profile, because what our scanner is going to do is it's going to duplicate the emergence profile scan with the additional scan bodies added to it. So you can use either one of these, they do the same job. Okay, so if we use that one, for example, a little tip will tell you how to do that. So you cut around all the emergence profile areas, so multiple implants, do them all now, double click. Okay, this one again. Just for this example, we're going to leave the lateral, we're just going to do this posterior region. And what that does in the background, it tells the software, do not auto fill in any holes in this area, so that we don't fill in, because any areas that you haven't scanned get automatically filled in around the rest of the arch. So that's why we use this little cutting tool. Then we go to this icon and you press that button there, and now we're going to screw in the scan bodies and then add the scan bodies to this pre-existing scan. Now, as you can see, there's multiple scan flags in this region. So if those scan flags are identical and identically placed, you want to differentiate them by using this identification tool here. So you click on that and then click round one area. So the scanner will now concentrate on that area. It won't see any of this area. So you could feasibly use one scan flag for both sites here. You can scan this area with one scan flag. So we come off that icon into the mouth. The scan flag is screwed in situ, and there we go, it finds it. So as I said, the blue area will not be scanned. So we're just stitching in this area. That is a very useful tool if you've got two scan flags very, very close together and you need to get to the buccal or distal walls of each individual scan flag and they're close together. There we go. So that's added that. So now what I will do is I will change that again, and the region of interest now will be this area here. So I'm actually unscrewing that scan flag and popping it into the adjacent area. Okay, so I've screwed the scan flag into here on my model. Now go in here, reverse that. Okay, and then come back in and find your, as I call this, a landing strip, an area where your scanner is going to go in, and it won't be the blue area. So give yourself some space for the scanner to go in and recognize, that's where I need to be. There we go. And now we're picking up the same scan flag in a different site. And that is it. Now you push this scan forward to be refined. Refine it in a high resolution, always, if you're sending work off to the laboratory. And then you will get two sets at the end. One set with the emergence profile and one set of upper and lower in occlusion with the scan flags. And that's what your laboratory receive. So now we've refined the scans, it's tidied up your scans for them. You can view this in a high resolution and then with a matte view as well. This is good for looking at contrast. So this is the scan with the emergence profile. Let me just remove the lower arch out of the screen. Let's have a look. And then if you flick the icon here, you will see the scan with the scan flags added, or in this case, just the single scan flag added. So that's what goes off to your laboratory. So here we are on the save file. So just make sure, handy little tip here, just make sure you tick that box that it is an implant scan. It's not an ortho scan or restorative scan. If you were inadvertently to use the ortho scan, then the lab would only get one set of those scans, the pre-op scan or emergence profile scan. So remember to scan and save as an implant, and then save and exit. So here is your saved scan in CS Imaging. If you want to have a look at that scan, open up CS Mesh Viewer, and it will open up, as explained, 2 sets of scans, although it's been a duplication, so you only needed to scan this first set and then add the scan flags. So let's look there. And this is what your lab can import. And the beauty is in lab software, they can overlay this on top of this, so they can click on and off the position of the scan flags. And that's it.